Governor Larry Hogan delivered his State of the State message on Wednesday, and he cautioned all Marylanders that the best hope for bringing the coronavirus pandemic to an end is through vaccinations, but that it will be a long and difficult journey to get everyone vaccinated. Immediately afterwards, the Baltimore Sun accused the Hogan administration's rollout on the coronavirus vaccine as slow and confusing. This criticism was reiterated by County Executive Mark Elrich, who complained that Montgomery County has an excellent plan in place, but is hampered by the lack of supply given it by the state. Cynthia, has Hogan bungled the vaccine rollout as Montgomery County Delegate Eric Ludke claims?
Well, there's a lot of frustration out there. And one of the problems with the way that the vaccination rollout has started is that it's extremely decentralized. So for instance, in Montgomery County, the health department is getting vaccines and they have one way of distributing them to a certain parts of the population. Private healthcare facilities have another way, hospitals have another way. The sign-up process is confusing. The technology is allowing people who are not qualified and who are not in the approved groups to pre-register and re-register and re-register. So it is really, really confusing, and the state as well as localities need to get their arms around this and figure out how to make it more efficient and to make the registration process more streamlined and equitable.
But wasn't the idea of having multiple vendors the idea that it would be more available to all Montgomery County residents? Wasn't that the original idea in place?
That is the original idea, but when you have hospitals where, you know, say an adult who's 60 years old has no underlying health conditions and somehow signs up to go to White Oak and then gets there and their appointment is canceled because they're not a healthcare worker, then that's not the way to go. There has to be a sign-up system that is technologically corresponds to what is allowed. So okay. The technology isn't working, and the different criteria based on who has vaccines is also extremely confusing. But
well, I got to go to Linda. We're running out of time on this segment, Cynthia. Thank you. So Linda, Cynthia brought up the issue of equitable distribution of the vaccine, and Senate President Bill Ferguson was critical of Governor Hogan for not addressing how the pandemic has hit some Marylanders worse than others, including the rate of infection and deaths among people of color that are disproportionate to their population. So is it a problem in the system, or is it a problem in that we don't have an ability to be more equitable in how this is distributed?
I fully agree with the sentiment of equitable distribution, and I agree that the communities of color and lower socioeconomic standing are hardest hit by the coronavirus. However, we do not have the luxury to craft an equitable distribution or a more equitable distribution system simply because we don't have the supply right now. We've only vaccinated in this county 7%, if that, of our population. And we're losing time. And the few meetings I've attended that the council has held, they've pointed fingers at the Hogan administration, and then the Hogan administration points fingers back. I'm tired of our leaders kind of doing that, and we need to up supply and also, as Cynthia mentioned, create a more kind of clear technological database by which and distribution system, and that's not in existence. So we don't have the luxury of going to equity right now.
Yeah, and bottom line, Linda put her finger on it. There's not enough supply, and so people are literally fighting each other to get vaccinations. We're pitting teachers against healthcare workers, against 75-year-olds, against people who work in elder care and nursing home residents. We have 3 categories in phase 1 that are open for either pre-registration or vaccinations, and people are just, it's like Lord of the Flies.
Well, I will say, that I'm in that 1C category, which opened up this past Monday, and I registered on the county's website, and I've heard crickets since then. And I've also gone to several other separate vendors to see if there are doses available. If you are aggressive about seeking out the vaccine, you probably can find it, but you got to really look for it, and you've got to look at multiple websites in order to find it. And frankly, I don't know if people have that much time to spend, getting on the giant food website at noon, and then again at 3, and then early in the morning. It's literally chaotic, and fortunately, I hope everybody can get it in due course. We got to wrap up and go to our next topic, which is even more fun.